Hi, I'm Dr. Vivek Kaul, and I'm Professor of Medicine in the Division of Gastroenterology and Hepatology at the University of Rochester Medical Center. It gives me a great pleasure to do this presentation in collaboration with Medscape. I have just returned from the Digestive Disease Week 2022, which is the largest international GI conference. And this time in 2022, it was held for the first time in person in 3 years due to the pandemic. Now, whereas there are a lot of best of DDW, as it's known, presentations out there for gastroenterologists, there are not that many for primary care providers. And I thought it would be a good idea to do this in collaboration with Medscape for our primary care colleagues to bring some of the more latest updates based on scientific presentations from this meeting. And what I've tried to do is to bring some information that is here and now and almost imminently translatable into clinical practice. Talk about a little bit in the middle future range where things will become available in the next few months to years. And then, of course, reflect upon concepts that might become more standard paradigms of care in the distant future. So my collection of papers is divided into the esophagus and the colon, and then finally finishing up with the liver section. So starting with the esophagus. So the first paper in the esophagus realm is this interesting paper, which was a multi-center study. It's called the Association of Proton Pump Inhibitor Use and Cognitive Decline and Incident Dementia in Older Adults. So basically what they did was they looked at about 19,000 patients, 65 years and old, who were on PPI therapy and had no significant disability or prior dementia. And they followed them up for about 5 years. And they found that a total of about 566 of them developed dementia in this time frame, and 235 or so had Alzheimer's. But what they concluded based on their analysis was that PPI use was not associated with dementia or changes in the overall cognitive score. This is important information. So as the AGA guidelines and others have suggested and recommended, those patients who do require PPI on a clinical grounds, on clinical merit, should definitely receive it. And the side effect profiles are quite well acceptable. And the second paper is an interesting paper, which is also related to GERD therapy, but introduces a new paradigm in GERD therapy known as potassium competitive channel blockers. So this is a new drug that has now become available, which is known as vonoprazan. And this was a double-blinded randomized trial of the potassium competitive acid blocker vonoprazan in comparison with lansoprazole, which is a well-established medical agent available for the treatment of esophagitis. So these were patients with erosive esophagitis in a multi-center US and European cohort, about 1,000 patients that were prospectively treated. Crux of this study was to say that vonoprazan, which is the new agent, which is the potassium competitive channel blocker, is quicker to provide healing and symptom relief, and that these results are maintained in both the initial phase, which is the treatment phase, as well as in the maintenance phase. So there might be some advantages in terms of how quickly we can treat these patients and get them symptom-free. So that was, I thought, an interesting paper that was worth mentioning, because it reflects, after a long period of time, a new class of acid suppression therapy, which we should all be familiar with, and certainly at the primary care level. The next paper that I thought would be interesting relates to Barrett's esophagus and esophageal cancer. And this was an interesting paper, came out from Florida, the Floridian Electronic Health Record System, known as the One Florida Clinical Data Research Network. And the title of this paper was An Alarming Increase in Prevalence of Esophageal Cancer in Barrett's Esophagus in Middle-Aged Patients, findings from a statewide database analysis. So in summary, this paper basically talks about the increasing prevalence of esophageal cancer in Barrett's in the middle-aged patients, those patients who are in the 45 to 64 age group, and the fact that the esophageal cancer prevalence is rising in this cohort. So as you see in the first graph, the orange line is depicting the 45 to 64 age group patients whose esophageal cancer prevalence has gone up. And in the second graph, it's actually the gray line, which looks at the Barrett's esophagus prevalence, which is also increasing. And all the other cohorts have either plateaued off or are declining. So this is important information because these patients who are at risk in these age groups with these demographic profiles should be referred on for endoscopic screening to rule out Barrett's at least once in their lifetime. And most certainly a certain percentage of them will be found to have dysplasia and or early esophageal cancer that might be amenable to endoscopic therapy. So an important paper, and this concludes our esophagus section. So the next section that we'll talk about will be the colon section, and we have a few very good high quality papers with some provocative information in this realm. So the first paper in the colonoscopy section is referring to the concept of colorectal cancer screening. And while we have multiple modalities available for colorectal cancer screening today, fully a third of the eligible patients are not getting screened. So this is a study looking at a blood test for colorectal cancer screening. We have colonoscopy, we have a stool DNA and other tests, but now we have a blood test as per this paper looking at circulating tumor DNA. So if we look at this paper, this is a prospective study, which is a multi-center study from Madrid, Spain. So they enrolled about 550 patients between 45 and 84 years of age. And this is a blood-based colorectal screening test. This blood test was completed prior to the complete colonoscopy. The prevalence of colorectal cancer screening in this study was about 2%, and the sensitivity ranged from about 90% to 95%. And the specificity ranged from about 100% to 88%, depending on what confidence levels you were looking at. So in this prospective study, a blood-based colorectal cancer screening test was able to perform very similar to that reported for stool-based options, and therefore it may further increase the probability that patients might come in for screening. So the message from this paper is that there's yet another modality looking for colorectal cancer screening, and now we have a blood test potentially, but obviously look forward to more data on how the test itself performs, and there probably will be other candidates in the same realm. So the second paper in the colon section is also a very important topic in clinical practice for all of us, and that is C. difficile infection. So as you may know, the current guidelines have recommended the use of fidaxomicin over vancomycin as the initial treatment for C. diff infection. So this paper actually looked at retrospectively a cohort of patients in the real world and compared them to the efficacy of fidaxomicin versus vancomycin among Medicare beneficiaries with C. diff infection. It was a multi-center US study. The initial results here suggest that the treatment with fidaxomicin had higher sustained response compared to vancomycin at both weeks 4 and 8, as well as the decreased recurrence of C. diff when treated with fidaxomicin. The rates of CDI recurrence were also lower for fidaxomicin versus vancomycin at weeks 4 and 8, respectively. This retrospective study further confirms that C. diff infection remains a problem and that we might have better solutions now with fidaxomicin compared to vancomycin. So that's an important information and is already endorsed by the guidelines. The next paper in the colon realm is also an important paradigm that has entered our clinical practice, and that is when we are treating patients with GI symptoms, the role for cognitive behavioral therapy and mindfulness interventions has now come of age. So this here paper looks at a randomized controlled trial on the effectiveness of cognitive behavioral therapy and mindfulness intervention on the aspects of pain and fatigue, as well as impairments at work and daily activity in patients with Crohn's disease. Now, this is a difficult population with chronic illness, and this study comes out of Israel. So about 120 patients basically randomized in a randomized controlled trial fashion to 7 one-hour sessions of psychological training over 12 weeks. Essentially, the placebo group was the control group that did not get this treatment. So these interventions reduced both fatigue as well as pain levels, as well as reduced work and home impairment, and so overall led to a better quality of life. So this paper is important because it shows us in a randomized trial design fashion that a difficult clinical population with Crohn's disease, with a multitude of systemic symptoms and psychological, psychosomatic issues as well, coming from chronic illness, can be positively impacted by these newer strategies related to cognitive behavioral therapy and mindfulness interventions. And we'll likely be seeing more of these type of papers coming out, not just for Crohn's and IBD, but also for functional disease, which is where this started. And our final paper in the colon section relates to an interesting concept, which is the treatment of chronic idiopathic constipation, not IBS with constipation, but chronic idiopathic constipation being managed with a novel device known as the Vibrant capsule. And the Vibrant capsule is exactly that. It's a capsule that the patient ingests, and it vibrates and therefore creates a mechanical movement. So looking at this paper, the efficacy and the safety of Vibrant capsule for chronic idiopathic constipation, a randomized, double-blind, multi-center, placebo-controlled phase 3 trial. It was a US multi-center study. So in this case, the device is an orally ingestible, programmable Vibrant capsule, which was developed in Israel. It basically mimics the biological clock and increases the stool frequency by augmenting the circadian rhythm. So this was a prospective trial, 350 odd patients, and there was significant improvement in the complete spontaneous bowel movement pattern, both for 1 and 2 bowel movements per week, as well as this significant improvement persisted at week 3, peaked at about week 6, and then remained sustained through 8 weeks. The Vibrant capsule also was able to improve stool consistency and the overall quality of life. So this is a novel treatment intervention over and above all the medical therapies and the bowel regimens, which of course our patients find somewhat difficult, understandably. But this might be a complementary direction to go in, and we'll probably hear more of these novel interventions for chronic constipation, which is a huge problem both at the primary care level as well as in subspecialty practice. And in the final section, which is the liver section, I found one paper very interesting, which refers to the concept of lean NAFLD. So NAFLD, or non-alcoholic fatty liver disease, is an epidemic throughout the country with obvious implications both for the metabolic syndrome as well as chronic liver disease. So this paper from Wisconsin looks at lean NAFLD in the United States and characterizes the central and visceral adiposity and compares it to overweight and obese patients. So lean NAFLD occurs in about 10 to 20% of patients with a normal BMI. 1,800 patients were evaluated in this particular study, and they underwent cross-sectional analysis with elastography and the so-called CAP score that looks at the measurement of fat in the liver and DEXA measurements and so forth. So what they found was that patients with lean NAFLD are more likely to have hypertension, diabetes, high triglycerides, and more likely to smoke compared with lean patients without NAFLD, despite having similar BMIs. A couple of additional observations from this study was that central adiposity was similar in lean NAFLD compared to the obese non-NAFLD population. And the visceral abdominal fat in patients who have lean NAFLD was slightly higher, actually, than even the obese NAFLD patients, but the P-scores were not significant. The overall summary from this paper was that NAFLD should be considered in lean patients with risk factors of the metabolic syndrome. And this is an important paper because it highlights the fact that we don't necessarily have to be externally obese or have a high BMI to necessarily be at risk for the metabolic syndrome. I think the importance of evaluating for the metabolic syndrome, even in those patients who have a relatively lower BMI, is underscored by this paper, which has significant implications given the large denominator of this population in this country. So with that, we come to the conclusion of these top papers from Digestive Disease Week 2022. We covered a gamut of conditions from the esophagus through the colon and to the liver, and these represent some of the best science that was presented at this very large international meeting. I hope you will find value in this information in the care of your patients, and look forward to presenting again when the next opportunity arises. I thank Medscape for this opportunity and for this collaboration. Thank you.